Well, we have talked a lot before about hormones and insulin resistance and thyroid. Today, I want to talk about one of my favorite hormones, or at least start out with, and that's testosterone. And people might say, "Well, Sarah, you're kind of crazy. You're a female. You're not supposed to like testosterone." But testosterone feels good. It feels good. It gives you energy. It gives you that drive to go out. It gives you a sex drive. It gives you the drive in the gym. It gives you that just energy to do life. And when I don't have it, and I can feel it when mine goes up and down, I don't feel as great. So let's talk about the importance of testosterone, not just in men, but in women.
Yes, that is testosterone is my second favorite hormone next to T3, the active thyroid hormone. Testosterone, it's overlooked in the treatment of women. It's overlooked in women's health because even the medical system tends to think about testosterone as a male hormone. Now, it is more dominant in males, but females need it as well. And we need it in those optimal ranges. So just like we want your thyroid optimized, we want your testosterone optimized. I call it the GSD hormone, the get stuff done hormone, because if without it, you have no motivation. You can't get all the things done that you need to do. And as women, we're taskers. We tend to have a million things on our to-do list. So without that hormone, you're not going to have the motivation to go to the gym. You're not going to have the motivation to go to the grocery store. You're not going to want to have sex. You're not going to have sexy lean muscle that then makes you more metabolically active to be able to burn more body fat. So it really is up there on the most important hormones that you need in those optimal ranges to live your best life.
So first, what are those optimal ranges?
Yes. So just like we've talked about before, we see with thyroid hormones, well, we see with pretty much every lab value out there. When you look at your blood work, that standard lab value range is going to be huge. And you could be normal, quote unquote, with a testosterone level of a 3, of a 10, of a 15. You're still normal. Your doctor won't look at it if it's not flagged. Optimal testosterone levels for a woman, 50 and above. Now, 50 on some labs is actually cresting over the upper limit, because I'll have patients say to me like, well, wait, I'm flagged high at 52. That's okay. That's where I want that total testosterone to be in order for you to feel your best. Now, I do have some patients that love their testosterone levels 120, 130. And they say, don't you dare lower mine. And I say, as long as you're not getting androgenic side effects, as long as you're not breaking out, you're not getting excess facial hair more than what we get just from aging, that's fine. We can keep your test level high like that. And we just keep it in that nice sweet spot range for that particular individual, as long as they're not getting androgenic side effects. But for most women, 50 and above gives them that life back. You get a little bit stronger at the gym. You get leaner. You feel more motivated. You're more not aggressive, but you're more kind of on point. You're getting stuff done. And that's the beauty of testosterone. So again, the issue with all standard lab value ranges, those were taken from a group of sick people. All those lab value ranges that you see on your labs were taken from large groups of people, and they didn't go through and pick out the ones that were fit and healthy and felt good and looked good and performed well. They took it from everybody. So you got your McDonald's eating, sitting in a chair 10 hours a day person over here. You got your diabetic that needs to lose 100 pounds over there. And they're all incorporating those people into those lab value ranges, which is why you could be considered normal if you have a test level of a 3. You're going to feel like garbage, but you're considered normal in the medical system. So that's why we don't go by normal. We go by optimal each and every time. Optimal.
I love how you, in general, talk about go by the way you feel because so many people come to me and say, I'm on my thyroid hormones. My doctor says I'm in normal range. I feel awful. Or I was just put on thyroid medication. I don't feel any different.
Yeah.
Well, you are your best doctor. Your gut feeling, your energy, doing life. How are you doing life? And that is such an important thing for people to clue in on. And I love the way I feel when my testosterone is optimal, and
Yeah,
I'm not going to sacrifice it. So,
exactly.
and with testosterone, especially as we age, you touched on the importance of muscle, and the muscle mass is highly correlated to longevity. And muscle mass is also something that is correlated with growth hormone. So, increasing testosterone is correlated with that increase in growth hormone. So, let's talk about the testosterone and how it affects growth hormone and your thyroid hormones,
Mhm.
both in a positive and a negative way.
Absolutely. So we know through a multitude of studies that low testosterone actually has an impact on your immune system, specifically autoimmune. So with the thyroid, with hypothyroidism, 95-ish% of all hypothyroidism is Hashimoto's. It's the autoimmune form of low thyroid. The other 5% that can be caused from excessive dieting, extreme exercise, certain medications. That's just where the thyroid just kind of craps the bed and stops working very well. But 95% of the time, it's your immune system attacking your thyroid gland. So when a woman has, and hypothyroidism hits women way more than it does men. So I don't mean to exclude the guys out there, but we are talking about mainly women here and the importance of testosterone in women. When testosterone goes low, you're actually at a greater risk for flipping that switch to the on position in autoimmune. So what I mean by that is with Hashimoto's, it usually presents itself after a stressor. That's why you'll hear women say, it was after my second kid. It was after I lost my job. It's after some kind of a stressor, even a natural stressor like pregnancy, will turn that autoimmune switch into the on position, and then symptoms start to occur after that. So, with low testosterone, you are at a greater risk of autoimmune conditions, specifically Hashimoto's, because it flips that switch on and then autoimmune presents itself. It's also the double whammy because if you have low thyroid function, we know you have low metabolism, you have low mitochondrial function, like you mentioned, you have low energy, low ATP production. Everything is low and slow, even gut motility. Your ability to poop every day slows down, and that's not good. With low testosterone, that's going to kind of add on and layer onto those symptoms that you're already dealing with hypothyroidism and Hashimoto's. So we know that it impacts the immune system. As we age, testosterone levels, whether you're male or female, are going to go down. Our muscle mass is going to go down. Our protein intake naturally, because I see this in all my female clients and I see it with myself, I'm just as guilty. Our protein intake goes down. And we need to not do that. We have to keep our protein levels up to protect our muscle tissue, but we also need adequate testosterone levels to protect muscle because without it, your muscle will start breaking down. That testosterone keeps your body in an anabolic state, not androgenic. So, androgenic side effects that I mentioned earlier, that's what you see from, the college football players that were taking too many steroids, or the muscle heads at the gym and they're all broken out, their back's all broken out and they're all beefed up. That's the androgenic side effect that we don't want you to have as a woman. We want you to have the anabolic, meaning the strength and the muscle growth and the metabolism from increased muscle mass. So to get that anabolic side, sometimes we have to address that low testosterone and supplement with it, not to bodybuilding limits, not to the point where you're going to turn into a dude. That's not what we're talking about. But we want to get you up into a very, very healthy, protective, anti-aging range so that you can stay healthy lean, muscular, and those muscles not only produce more of a metabolism, more of a fat burning effect, but they also protect your bones. They protect against fractures. They protect against blowing your knee out. They keep, your core tight. They protect your back. So there's so many benefits to it. We could keep going on and on. And you mentioned growth hormone. That's a big one as well. Growth hormone declines as we age. So if we rewind, what was this, like 20 years ago when Suzanne Summers came out with her book and everybody was reading and everyone's like, I'm on growth hormone. Well, that's really hard to get. You're not going to just walk into your doctor's office and say, hey, doc, give me some growth hormone. But you can do things to stimulate that naturally. Lifting heavy, having that testosterone level to the point where you are strong and you do have motivation, you want to go to the gym and you can pick up more than a 5-pound weight and you feel that strength. That is going to increase growth hormone, which is another anti-aging hormone. That's what keeps us youthful. It keeps our skin plump. It keeps us wanting to have sex as we get older. It keeps us nice and lean. So you can see how everything just works so beautifully together, but we can't set aside one hormone and focus on another. That's why I always say both and. Yes, we have to optimize your thyroid. And I want to look at your hormones too. And we look at insulin and we look at XYZ, but we have to look at those sex hormones to make sure that they are in alignment to give you the best life so you can look, feel, and perform your absolute best.
Absolutely. And you just mentioned insulin, and we don't need to dive into it, but insulin, if you're high insulin resistant or diabetic, that's going to negatively impact your testosterone and all of your hormones and your thyroid hormone. And so many women are struggling with constipation, right? And that's something that people don't connect with thyroid, but I can tell in my own body that if my thyroid's down, I'm not as regular. Things aren't moving everywhere in my brain, my intestines, everywhere. It's all connected. You have talked about DHEA, and how do you look at that in relationship to someone who is suffering from low testosterone?
So DHEA is a precursor. So our bodies can build testosterone from DHEA. Now, DHEA also affects the adrenal gland. So it's kind of a dual purpose hormone. I have seen women who are taking, let's say they're on bioidentical hormone replacement therapy. They're taking testosterone in some form or another, but they have super low DHEA levels. We still want to support DHEA because it's anti-aging as well. It's very neuroprotective. It helps your adrenal glands function properly. So if someone does have a low DHEA level, I will use that in addition to testosterone, or I'll use it in combination with like a test boosting supplement. It always has DHEA in it because that's that precursor to build up your own testosterone.
Okay. And also, how would you supplement or increase testosterone? Of course, HIIT training and some of the diet and the lifestyle things, as far as more animal protein. And you touched on protein. I think people need to be eating more protein as they age because the absorption is hindered versus when we are our younger version of ourselves. But all of these things. But outside of that, how are you helping your clients boost their testosterone?
So there's so many different ways. Like you said, Sarah, we have to start with lifestyle. If you're not sleeping deep, if you're not sleeping enough, if you're going to bed late, if you're not getting in that 10 p.m. to 2 a.m. restorative time that is built into our circadian rhythm, built into all of us. If you are eating like garbage, if you're keeping your insulin up, all of those lifestyle things, if you're not doing it, it doesn't matter what we do over here. It doesn't matter how much we supplement. It doesn't matter how much bioidentical hormone replacement we give you. It's not going to work. So again, everything has to work together. But let's say you are doing all the things. And I get many patients like this where they come in and they're like, literally, I am doing everything and nothing is working. Okay, well, let's look at your testosterone levels. If they are in the basement, we have to do, if they're not optimal, we have to do something to get that level up. Now, we have a variety of choices. So we can use supplements. There are great supplements out there. My supplement called the Hormone Fixer is going to be out soon within a couple of days. I specifically built that for low testosterone. I see it across the board. I don't care if you're 20 or 70. I want your testosterone as a woman at the total at 50 or above. Now, the free testosterone, which is the bioavailable, we can also look at that. That usually I like to see around like a 2.8 to a 3, as long as that is in like the mid range, because that can change with different labs. So for the free testosterone, I say mid to upper range for the free, but total is pretty much the same across the board. That should be 50 or above. So we want to address that. We can use supplements. We can use injections. So a lot of women kind of get freaked out, like, oh, I don't want to use a needle. That's okay. We can use a compounded cream. The only thing I don't like are pellets, those little pellets that they insert into your bum, because I just saw it today. A woman gets a pellet of testosterone. Her testosterone 2 months after that pellet has been in is 350. Now that's low for a man. That is really high for a woman. Like, you are definitely cresting into the androgenic side effects with a test level of 350. But here's the problem. After that pellet starts to dissolve and wear off, now you're plummeting down the other side and you're dropping low. And I see it each and every time someone gets pellets. And I know there's practitioners out there that love them, that swear by them. There's probably patients out there. You probably have listeners right now going like, well, Dr. Amy, you're totally wrong. I really love my pellet. That's fine. If it's working for you, it's working for you. Then you keep doing it. But if it's not working and you feel like you're on a roller coaster, and like you said, Sara, you can tell when your test level goes down. Well, the beauty about supplements, injections, or cream is you can then dose it at that time.
Right.
Even if it's a little bit earlier than what is intended to dose it, you can dose it when you start to feel yourself going down that other side. And when you get really in tune with your body, you can tell. The problem with pellets is they're in and they're in until they're gone, and they're in until your doctor's going to put another one in your bum. So you have to ride that roller coaster, and sometimes that's just not fun. And then once it's in and you have a test level of 350, that acne is not going away anytime soon. And then you're layering on the drugs and the antibiotics and the creams and all that, trying to get rid of it. So let's just do something that's consistent. Let's keep your test level consistent all the time. And there's so many options now. It's silly not to. And with prescribing of testosterone, for some odd reason, the FDA classifies it literally like a drug, like an opiate. It's something like I could be wrong. It's like Schedule C. It's really, really, really hard to prescribe. Some states allow it, some states don't. Some states won't allow for injectables, some will only allow for creams. So that's why I decided to do the supplement route, because I know it works. I've been using this combination of ingredients in my female patients forever, and I have seen test levels go from a 3 to a 50 in a couple of months. So that's an easier route to go.
Well, I'm super excited about your supplement coming out, because I will be in line to test it out.